10 years ago, he phoned to me, sir, I am your patient for 2 to 3 years. ನನಗೆ ನಿನ್ನೆಯಿಂದ ಬ್ರೆತ್ಲೆಸ್ನೆಸ್ ಆಗ್ತಾ ಇದೆ. ನೈಟ್ 10 o'clock he phone. ಏನಪ್ಪ 25-year-old. ಆಮೇಲೆ I forgot to tell you that Nandinatpur patient who survived after, he is still living. Okay. Then he had a 6 months baby, still living. I want to write a book about all these things. ಇನ್ನೊಂದೇನೋ ಹೇಳ್ಬೇಕು ಅಂತಿದ್ನಲ್ಲ, ಈಗ ಹೇಳ್ತಾ ಇದ್ನಲ್ಲ. ಇನ್ಸೆಕ್ಟ್ ಬೈಟ್ಸ್ ಆಯ್ತು, ವ್ಯಾಕ್ಸಿನ್ಸ್ ಆಯ್ತು, beta blocker. So a fellow phoned to me. I am not telling that I am very superior physician or something like that. Knowledge is power. Knowledge is power. So some of my students or doctors, you contact ಯಾರೋ ಅವನು ಕೇಳಿದಾನೆ, ನೀನು ಡಾಕ್ಟರ್ ಚಿಕ್ಕಮಗ ಅವ್ರು ಕೇಳಪ್ಪ ನಮ್ಮ. ಸೊ ನೈಟ್ 10 o'clock ಈ ಫೋನ್, ಸರ್ ನಮಗೆ ಬ್ರೆತ್ಲೆಸ್ನೆಸ್ ಆಗ್ತಾ ಇದೆ. ಹೆಂಗ್ ಫೆಲೋ, ಏನಾರು ಏನ್ ತಗೊಂಡಿದ್ದೀರಾ? ನನಗೆ ಒಂದು ಇಂಡರಾಲ್ ಅಂತ ಕೊಟ್ಟಿದ್ದಾರೆ. ಯಾಕೆ ತಗೊಂಡಿದ್ದೀರಾ? ಹೆಡೇಕ್ ಇತ್ತು, ತಗೊಂಡಿದ್ವಿ. ಅಯ್ಯೋ, ಇಂಡರಾಲ್ ಕಾಸಸ್ ಬ್ರೆತ್ಲೆಸ್ನೆಸ್. ನಿಲ್ಲಿಸ್ತಾ ಸರಿ ಹಾಗೆ. Because beta blocks. So with this ಇಷ್ಟಾಗ್ಬಿಡುತ್ತ ಅಂತ ನೋಡಿ. ಆಮೇಲೆ NSAIDs, analgesics. Once a Kerala patient, she is still there in Indiranagar. Now she is 60-year-old woman. 4 years ago she came to me. She had some joint pain. She went to a local doctor. He has given aceclofenac. Aceclofenac, one tablet she has developed reaction. Ulcers in this, she has lost the vision. BP fall like this, anaphylactic. Any analgesics can cause. So be careful when you are doing some medicines, but tell the patient if something happens, you can't. So the present day trend is keep ready epinephrine and tell the people, educate the people. This is because we are teachers, we tell, educate the patient also. This is it. So you become God to them if you are saving life. So I thank one and all. I'm really happy in the crowd. This is in this age, it is like a treatment at USA. It is very well advanced. I saw the labs, you know. We have got all the latest investigation, treatment. So any allergy, I want to send to my Nagar. This gentleman has not invited to show earlier. You are late. No. Some 2 months ago, one West Bengal patient, I get patients from all over. One West Bengal patient, lady, about 30-year-old lady, her husband had diabetes, she came. Husband was all right. On honeymoon diabetes sometime, we detected. Sir, I have got a problem. What is your problem? The running nose, history, allergies are. I have seen so many doctors. No, I go to my student. So I sent. Next day she has come to my clinic. Sir, I wanted to thank you. Yakama nange thanks to you. Dr. Nagendra Prasad. Sir, with one day treatment, I am all right. I never had. So, congrats. May God bless you. So,
you are telling injection for this. One day she came with she takes insulin already. Or super over but declare computer ಇನ್ನೊಂದು ಆ ಕಡೆಗೆ ನೀವು ಅದರಿಂದ ಮತ್ತೆ ಮನೆಗೆ ನಾನು ಅವ್ರ ಮುಖ ಎಲ್ಲ ಉದ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ದೆ, ಇದೆಲ್ಲ ಉದ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ರೆ ಇಲ್ಲ ಮುಂದಕ್ಕೆ ಅಲರ್ಜಿ ಇಂಜೆಕ್ಷನ್ ಕೊಟ್ಟರೆ ಇದಕ್ಕೆ ಮಾತ್ರ ಇಂಜೆಕ್ಷನ್ ಅಲರ್ಜಿ ಆಯ್ತು. ನೀವು ಹೇಳಿದ್ರೆ ನಾನು ಬೆಟರ್ ಎಲ್ಲ ಕೊಟ್ಟೆ ಬರ್ತೀನಿ
So she came to thank me because I guided to the Prasad who gave her curative treatment like, sir, in my life ನನಗೆ relief ಸಿಕ್ಕಿಲ್ಲ. That is appropriate diagnosis, appropriate treatment. So I thank one and all. I am not seeing as though I am somewhere here. It is like home atmosphere. You invite me next year also, I will come and some more miracles I will tell. ಇಲ್ಲ ನೆಕ್ಸ್ಟ್ ಇಯರ್ ಬರ್ತೀನಿ. ಬರೋಣ ಮಧ್ಯೆ ಬಂದ್ರೆ ಆಯ್ತು. Right.
Surely. What an amazing session that we had for the past 15-20 minutes. I saw every face being totally so attentive over here. and we were all so much into these incidents that we hear. That 57 years old ago story.
Again,
Wow.
I'm taking more time. I thank you and your wife. The staff are so good. This girl is good. Others, they are all having good qualities. Humble, grateful, good in. I thank you, all the staff. See, we are physician. By looking at your face, we know what you are. Looking at the face, we know what you are. So I thank one and all of you. The staff, very good. And teacher-student relationship, 2 minutes I will take. She was telling something.
Yes, sir, please.
Once I wanted some information from you. My two sons are doctors. One is urologist, one is doctor. I wanted some information. Somebody gave some UK address. I want, sir, in the information sigutte. Night I phoned to a doctor. He is from Ballari. He was doing possession in UK. It happened about 8 years. I contacted him. Nodappa, Nano, I am Dr. Chikkamoga from BMC. Sir, please tell me. I am your student. Then, which college you studied? Ballari. I have not seen Ballari. So, I say, I have not come to Ballari so far because I was physician to VIP. They never allowed me to go to Bangalore. I am in Bangalore only. No, sir, you are my student. ಏನಪ್ಪ ಅದು ಹೇಗೆ ಆಮೇಲೆ it seems all intermedical students PGs had come to BMC post teaching program clinics Bombay in the Dr. Bombay Madras all inter ಎಲ್ಲ state ಅವರು physicians I was the chairman on the stage. So Ballari student on patient to case present ಮಾಡಬೇಕು. He has to present the case, then discussion. It is the teacher's training for PGT students. So it happened about 4 o'clock in Victoria. So I was sitting with all the others. This boy is presenting the case. He tells, I have auscultated, there is bronchial breathing, cavity. So I diagnosed it as TB cavity. All of a sudden, this Bombay wala got up. He's like irritated. What nonsense? Who is your teacher? How can you diagnose TB causes cavity destruction? How can you diagnose by auscultation? It's only by X-ray. How many was stunned? Student ಏನ್ ಮಾಡ್ತಾನೆ ಪಾಪ ಬಾಯಿ ಮಾತಿಲ್ಲ ಏನು ಅಷ್ಟು ನಾನು I am the chairman on the stage. Then he is right, the boy is right. ಅಂದ್ರೆ ನೀನು ಬೈತಾ ಇದ್ದಾನೆ ಪಾಪ ಇವನು ಯಾರೋ ಬಾಂಬೆ KPH ಇದೆಲ್ಲ. Then I told, don't scold the, he is right. You must have guts, otherwise how can you? No, he is telling cavity you can diagnose by auscultation. I have never heard in my life. No, you read Hutchinson clinical methods. That is the famous. He has given. On hearing cavitary breathing, you can diagnose here. That is what the student is telling. And you show the X-ray as well. X-ray shown, it is cavity. So he was saved. So if such a thing happens in MD exam, what happens to the student, they will fail him. So he is narrating the story. Sir, we had all come to BMC, you were the chairman. I presented the case. That Bombay wala professor scolded me. You came to our protection and all the students, we clap ಮಾಡಿದ್ವಿ 10 years. We have all got grace and respect. That is how I am your student. This is how our teaching. Okay. Such stories are there plenty. As and when, right.
For sure. I think everyone could just go on and on and on with your stories, sirs. These were so amazing, and these are so many life incidences for which they have gone through and they have grown and they have become what they are today. So please give it up for sir one time.
Thank you.
Surely. Great doctors, what I learned from here now was, great doctors have greater mothers, great teachers produce greater students. What a nice student-teacher relation that we see here today. I'm really surprised, and I think a lot of us would be surprised to see this Jodi, I could say, this pair coming over here. I'm sure this is a proud moment for you, sir, to see your students coming out with such flying colors. And also the students over here, many like me and so many like them would be so happy to be having you as their lecturer, sir.
You are
A
from
lot
which
of
place?
pleasure. I'm here from Bangalore.
Pharmacy.
So I think he has had experience of a little touch of humor to bring the dead man alive. I think people just say, oh, you cannot do it. But I think sir did it, right? This was amazing, sir. We are really privileged to have you
Thank
today
you.
here. Further, I shall request Dr. Paranjyoti Kanni, sir, to please come forward. It gives me again immense pleasure to be introducing to you our Dr. Paranjyoti Kanni, sir, who has done, I'll just restart. I stand here with great pride to introduce Dr. Paranjyoti Kanni, sir, who has been an amazing inspiration to a lot of people in the field. He was an emeritus professor at Allergy and served as the director technical at Jagat Pharma for over 23 years. His career expands to solid 5 decades, where he has made remarkable impact in the industrial advisor, professor, research director, and the principal scientist. I welcome Dr. Paranjyoti Kanni, sir, to please come up on the stage and give us the insights about Bangalore Allergy Center and the foundation. Please come up, sir.
Thank you. Good afternoon to all of you. It was an exciting presentation by Dr. Chikumoga. We cannot forget it, as he said that we will invite him next year.
In advance.
Yeah. So, Bangalore Allergy Center, established in the year 1980. Professor Dr. Shivpuri, father of allergy management, met our Dr. Nagendra Prasad. He came here. He only named the center as Bangalore Allergy Center. Today, we affectionately call as BAC. BAC team today has over 20 staff. Doctors are there, pharmacists are there, biotechnologists are there, nurses are there, lab technicians are there, and always interestingly that the business people are also involved in incorporating in the Bangalore Allergy Center. BAC Pharmacy has got pharmacies, 6 pharmacies, and we manufacture slit tablets. Slit means sublingual immunotherapy, slit film or slit stripes, and diagnostic agents, and also nasal sprays. BSA Diagnostic has got the various diagnostic equipments, as you have seen that, all these equipments are there. And we finally do the SVT and then patch test, we diagnose. And after diagnosis, the prescription comes to our pharmacy, we make the medicines. Heartening news today is that all of you, to tell you that we will be moving to the modern, ultra-modern facility in this year, before the ending of this year, 2025. That's the heartening news. BAF is a holistic approach to help the suffering humanity. It ustablished in the year 2017, having trustees Dr. Nagendra Prasad, the founder, Dr. Sudha Nagendra, Dr. Puneet, Dr. Paranjyoti, Gopinath, Satyanarayana, and then Dr. Puneet. Vision and mission to enhance the quality of life who suffer from the allergy through the education, advocacy, and research. We provide free medicines to allergy patients for 3 years. We conduct camps. We conduct seminars and symposiums. We also have the patient-doctor interaction on all the Saturdays of the last month. And logo of our Bangalore Allergy Foundation is that Sarve Shantu Nirmaya. That means live good, happiness life to everyone. And we also give
life achievement awards to eminent scientists. Coming to Bangalore Allergy Foundation Academy. BAF Academy we started in the year 2020. 2020, 5 years back. Yeah, it is the offshoot of BAF and giving the education at the modern level to all the fellows. Vision and mission of this imparting and dissemination of the knowledge to all allergy suffering individuals. And we are running now fourth batch. Fourth batch is running. We have already completed 3 batch. The program is of 1 year course with the allergen and allergy specific immunotherapy. Now, in this Dr. Nagar.
Yes, sir. I'll start with it. I'll just say a word and I'll start. Thank you so much for giving the insights about BSc, sir. Doctors are superheroes in white coats. Let me quote it again to you. Doctors are superheroes in white coats, a personality that dedicates their life to the wellness and betterment of the society. It is my privilege today, standing here, being surrounded by a number of doctors, right? I think we are all really great to have such doctors around us. A very strong example for the statement I just said is the speaker for the day. Our speaker for the day, Dr. Nagendra Prasad, sir. I request Dr. Paranjyoti Kanni to please introduce our speaker for the day. Please give it up for sir.
As I have told you, Bangalore Allergy Foundation, we call BAF. Then we got BAF Academy. And then we have got Bangalore Allergy Center, which told it earlier. So Bangalore Allergy Center, BAF, and BAF Academy, all the organizations, Dr. Nagendra Prasad is the founder. So Dr. Nagendra Prasad is the founder of BAC, BAF, and BAF. He has 45 years continuously practicing as an allergy manager. And Dr. Nagendra Prasad did his MBBS from Mysore Medical College in the year 1976, correct? So he's full-time practice allergy and applied immunology at Bangalore Allergy Center, started from the year 1980 onwards. 45 years. Another 5 years, we'll be celebrating golden jubilee. So 27 original papers presented in the published national and international conventions, journals, and chapters in the books. Member of European Academy Allergology and Clinical Immunology from the year 2020. Overseas member of the American Academy of Allergy, Asthma, and Immunology to 2002. Fellow of Indian College of Allergy and Immunology in the year 1984. Life member in 17 medical societies in India. Member National Expert Committee, DCGI, Drug Control General, in formulating and regulating batch release of diagnostics and therapeutic allergens in India, 2015. Slit drops was initiated in India first time in the year 2003 and slit tablets in the year 2014, approved by the Drug Controller of Karnataka. He is having the patents on the nasal filters, slit stripes, slit tablets. And he is the joint possession of collaboration of Indian Institute of Science in Bangalore. Let us give him a big hand. I now present Dr. Nagendra Prasad.
ಇಲ್ಲ ನಿಂತ್ಕೊಳ್ಳೋಣ
ಇಲ್ಲ regarding the Dr. Chikmoga, first I was posted in the medicine. Dr. Shinde is boss. So usually the medicine post will be 2 months. After 2 months and every rounds
he used to make and discuss, and he used to ask some questions regarding the particular case, and we used to have a lot of interactions. One day it so happened, I don't know, he was asking small question, and I could not. It was already done. What he asked is already done, but he was asking repeatedly. He has got some style of asking repeatedly. Then after third repeat, really I became very wild, and I was arguing with him, and after that he kept quiet and he didn't say anything, and we went to the next patient, and rounds went on, and of course
Remember,
after that event is over, he took us to the canteen and gave us beautiful coffee and sweet kara, and we enjoyed. And at that moment, I realized that why I was arrogant, and I became very close friend of him. And he was a very good teacher, and he taught us very nicely, especially in outpatient. He used to teach very nicely. That was the close association with Dr. Chikmura. Coming on to the today's topic, we were discussing about the anaphylaxis. As Dr. Chikmura said, it is against the protection or against the immunity. We are all protected with immunity. Any disease from an external source, that is protected by immunity. So in Latin, it is called exaggerated sensitivity. The sensitivity of an individual is exaggerated. They call it as anaphylaxis. And the event is a life-threatening event. So one should be very careful in identifying the life-threatening, and we call it as anaphylaxis. And also we should know another similar sequence which happens, that is called vasovagal attack. And most of our staff, as coming across with vasovagal, they will be listening, suddenly it will collapse. They'll be talking, collapse. They'll be standing, collapse. So one should be very careful in identifying the real vasovagal attack and anaphylaxis. Anaphylaxis is IgE mediated disorder, and which is involved with the mast cells, and which release a lot of chemicals into the system, and which attacks on the blood vessels and the neurons and the heart. It is a strange attitude. So in most of the other cases of allergy, we take a detailed history, but in case of anaphylaxis, we can't take the history. Only the event we had to identify what the event which has happened. It has to be acted immediately. And if you start taking history, by the time he will be already dead. So one should be alert, and one should be active and see that what is needed to the patient, it should be given. And there are different signs and symptoms will be there. And there are 4 stages of anaphylaxis. One is the initiation of allergy which has happened, which likely to build up, which happens before the symptom starts. And when the symptom starts, then you'll be having a tingling sensation or a rash and itching all over the body. By the time you observe these facts, then immediately they go to the systemic reaction, that is called stage 3, and which happens all within few seconds and minutes. And you should be very, very alert in observing the patient. And after anaphylaxis, if it's not properly attended, then he will collapse. So you should be very careful in these cases, and you should understand, and you should not wait for the stage 1, stage 2, stage 3, stage 4, but you have to assimilate yourself and diagnose properly so that you can save the patients. And there are different varieties of anaphylaxis, which he also narrated, Dr. Chikmagar narrated. One is the insect bites. The insect bite commonly we see in India is the honeybee bites. This honeybee bite, a couple of weeks back, I had one patient, he's in a remote village. And from the remote village to get a doctor, he has to travel about 7 kilometers. And to get a hospital, he has to go for 25 kilometers. And that was his situation. And he had an anaphylaxis, but he could reach the doctor within 1.5 hours. And the reaction was not very severe and vigorous. And he could able to save. And that doctor has referred here. And we saw that he is sensitive to the bee bite. And so I called in that particular doctor and thanked him that you are referred. And I told him we are preparing a vaccine. You had to be given in the form of injections. And he said, no, sir, he is very far off, very difficult for him to catch and do the treatment. And I am not able to give, even if anything happens. The hospital is about 20 kilometers away. If any anaphylaxis happens, I can't able to manage. So all these factors he has narrated. Then I told him, okay, we will give some alternative dose that is called sublingual immunotherapy. We prepare and we give you. So you send back all those vials, and he has sent them back. And we started a formulation for the sublingual, and we started giving him. And I was also a little nervous because he's in a remote place, and if he start taking, if he gets any anaphylactics, then who will be treating this? And later we have given very high dilutions, and which is not likely to induce any anaphylaxis. And we sent him for 2 months, and he came back after 2 months, and he said he had a very comfortable relief. And he said that I had one more bite, but didn't cause any reaction as it was in the first bite. So that saved me my life, and we continued. And now recently, a few days back, he came, and he was very comfortable. So this stories goes on like this. I had one more patient, which is referred by one of my doctor friends, and his brother-in-law. And for no reason, he used to get collapse. He was an engineer, and he went to some hotel, and he took some food, and he had a swelling in the lips and eyes and ears, and immediately rushed to the hospital, and he has taken some treatment. And the early stage of anaphylaxis, and then again after a couple of 3 months, he had one more episode. Then they came back, and I gone through all the details. Then I found that he is on AC inhibitors. AC inhibitors. And AC inhibitors sensitize the individual, and you should not be given to the patient who are prone for the allergy reactions. So I told him, you go back to the cardiologist, you tell them that I have told you that you had to take the AC inhibitors so that sensitization will come down and he will be comfortable. I had one more doctor's wife, and she was having angioedema plus urticaria, and it was very severe. And she was admitted in a hospital because he was working in one of the high-tech hospital, and the wife was admitted in the hospital, and they were given the steroids and antihistamines, and antihistamines not working, and she was giving a overdose of the steroids, and steroids could have withdrawn, and it continued for 3 weeks. And after coming here, then I found out she is really airborne allergy reactions. So airborne allergy reactions, I told him that we had to go for detailed testing, and we could able to give some clear picture. And we found that she is allergic to the moth.
Oh.
And a moth is very, very common nowadays and inducing the reactions. And I told the particular patient that you should start using the mask and prevent getting this. And I told him you have to withdraw the steroids as early as possible. And I have written the biologicals. Biologicals has got a little role in the allergy, but people have started using it as friendly for their pockets, and therefore they are giving an liberal, and which is costing 30,000 to 60,000. Now the recent one is coming with 1,20,000. And these drugs do help them, but again the recurrences do happen. Huh? Monoclonal antibodies. And these monoclonal antibodies, it is not a active immunotherapy, is a passive immunotherapy. Whatever the molecules which is responsible for that particular disease will come down. When it comes down, once you withdraw again, after some time, it recurs. So this is only for people who are admitted in the ICU and they are depending on the steroids, then they have to be given. But now in their day-to-day practice also, they started giving these biologicals, which is a limited role. So I'm not going into those complications of inflammation. Another factor is exercise-induced asthma or exercise-induced anaphylaxis. People take their foods and they go for a gym or a treadmill exercise, and after 15 minutes or 10 minutes, they will get collapse on the treadmill itself, which is happening earlier. It was happening very occasionally. Now I'm hearing very frequently, which is happening. So one should be very careful. So if you want to do any exercises, before the food, you should go and take the exercise and be comfortable. And there are certain foods which has to be avoided.
Urologist guidelines.
Is it?
For doing exercise, in this residency road, is a famous urologist. For doing exercise, 5 years.
This is because of this exercise-induced anaphylaxis. So the management of anaphylaxis is only one drug, and which is the adrenaline, epinephrine, which has to be given. And in the West, it is EpiPen is available in the market, but not introduced in India. But the drug content is available in the form of ampules, injectables. So we had to train the patient in the tubercle syringe, how much the volume to be drawn and how to be injected. So that is the only version. Now the new FDA approved epinephrine is in the form of intranasal spray and sublingual. And under the head of Dr. Paranjyoti, we tried the sublingual adrenaline and it was working well. Somehow the drug controller could not approve this because he was not very sure about our, though we have given number of cases and how they are responding and they could able to give. So EpiPen training to the patients are very, very important. Adrenaline is very important. Even now, if you go to the casualty, I've got an anaphylaxis, you have to treat, they will not give the adrenaline. They give only antihistamines and corticosteroids. Corticosteroids have a late effect. That means the adrenaline acts within seconds, but corticosteroids will take more than a minute. So by that time, the aggravation of the anaphylaxis will be there, and it is not a life-saving drug. So EpiPen or adrenaline has to be injected. Though they have adrenaline, even with a trained staff nurse, they are afraid to give the adrenaline. I don't know why. And now, earlier we were giving in the subcutaneous form. Now they have approved for the intramuscularly, it should be given. And it is giving very fast relief. And I had one case with anaphylaxis. I gave the adrenaline, IM, and the symptoms came down very fast. And they survived. So these are the examples one has to see. And that's why this anaphylaxis, WHO declared as this allergenic, which has to be discussed and it has to be notified. So there are different class of people who are exposed to the chemicals in a different arena. In a housewife will be exposed to the so many chemicals like whatever it may be in a fine form of powder like detergent powders. That also induces the problem and it has to be taken care of. So like this, even the barber is exposed to the dye and is inhaled the dye which is inducing the anaphylaxis. So the medical staff, latex induced allergy. They use the latex gloves and that sensitizes the person either to the patient or to by himself. And see if the latex allergy is commonly seen with dentist. Any dentist, they put the gloves and they start using it. He may not be having a problem, but a patient who is sensitive to the latex, they get a reaction. And we are seeing this bee bite allergy is very common. Recently, we have seen one story with Lal Bagh, the child who came to the Lal Bagh, and after flower show, when they working out, the bee bite was there, and the baby was collapsed. And you see, our mentality of the public is to give the relief, but they will not give relief. Overcrowding, and they could not able to make the patient to breathe properly and take it to the hospital. And they wanted to make it attempt for relief on the spot. That is very, very bad. So the moment Lal Bagh is surrounding, there are so many hospitals, they would have gone to the hospital, they would have given the treatment and they saved. So these are all examples I'm giving you. And we have to make the anaphylaxis to understand by everyone so that they will be more comfortable. So with this background, we had to make anaphylaxis not a threatening one. It is not a threat to the doctor or to the patient if it is properly treated, approved, and they give a total relief. But once they get anaphylaxis, they're likely to get anaphylaxis subsequently also. So one should be very careful. Avoidance is the best. So with this, I am closing this, my lecture. If you have any questions, you can ask.
Thank you so much, doctor, for providing such an insight about the topic today, anaphylaxis. I think we can make some important points in our mind that we should be known about. Anaphylaxis is surely a life-threatening event that occurs. It is an IgE-mediated disorder that affects the mast cells of the body. And in case of anaphylaxis, there are 4 steps that doctor was saying is about. Anybody who could answer me? Any 1 or 2 steps? Yes? Yeah? Anybody? There were 4 steps. Yes? First is test dose, okay. The 4 stages of anaphylaxis goes like this. First is the initiation happens, where there is the test dose happening and there is the problem occurrence happens here. Second is the symptoms shown. Symptoms can be itching, swelling in the lips, and skin rashes. Then is the internal reaction, that is the systematic reaction that occurs in the body. And fourthly, and the last one is either the golden word in case of anaphylaxis is EpiPen. EpiPen to be administered quickly, and if not administered, there are chances of patient collapse. Thank you so much for providing such an insight, sir. Now, coming towards the conclusion of today's evening, I would like to call upon Shamika ma'am to please present the vote of thanks. Give it up for Shamika ma'am.
Thank you, Sneha. Good evening, all. So it's a great pleasure for me to deliver the vote of thanks on the occasion of World Allergy program today. So first and foremost, I would like to express my heartfelt gratitude to our chief guest, Dr. Chikamoga, to take time out of his busy schedule to be with us for sharing such an insightful thoughts. Your words have truly enriched our knowledge and understanding about the antibiotics of penicillin and importance of anaphylaxis also. So on behalf of all BAF, BAC, organization members, staffs, I would like to thank you, sir. Thank you so much. Okay. Our profound gratitude to our founder, CEO of BAF, BAC organization, Dr. Nagendra Prasad. Your words are not only informative, sir, but also brought a unique perspective that have enriched our understanding about anaphylaxis. So our heartfelt thank you to you, sir. Our sincere thanks to our Dr. Paranjoti, sir, for introducing the chief guest as well as our CEO of the organization. Well, thank you, sir. Heartfelt thanks to you. So my heartfelt thanks to Mrs. Sudha ma'am, Dr. Puneet sir, Mrs. Raki ma'am. So all the dignitaries and Dr. Sujata ma'am. And so many doctors here, I don't know their names. So one and all the dignitaries over here. I thank my heartfelt thanks, behalf of all. Thank you all. Okay. Then everything. I would like to thank the technical staffs, the photographers, the videography, then the melodious invocation by the BSA staff people. I would like to thank them also. So I thank the refreshment providers also today, that is Bharat Serum and Vaccines Limited. So I thank them also. Okay. Last but not the least, heartfelt thanks to one and all to making this a successful event first day. As a first day event, still 1 week to go on. Thank you, one and all. Thank you so much.
Thank you so much, Shamita.
Yeah, sure. You have to thank our comparing, sir. She's Sneha. Sneha. Yeah, heartfelt thanks to you, Sneha, for keeping us entertaining. Thank you so much, Sneha.
Thank you so much, Shamita ma'am. I think today was an incredible day, incredible session. The first day commencement of the event goes so smooth. It is all because of the whole team, the core team, and such doctors. These people are the pillars and the buildings and the skyscrapers of our society. I think we should all be really, really thankful and grateful to be having such an amazing crowd. Please give it up for yourself one time. Come on. With this, ladies and gentlemen, I request you all to please treat yourself with the high tea and snacks provided. Now about tomorrow, the session will be held over here in the Allergy Center. The timings will be from the same timing, 3 to 5, and the session will be up in the conference room. I hope to see you all tomorrow. With the same face, see you all tomorrow. Bye-bye.
Thank you. Thank you. Thank you.
Now I know.
Thank you, ma'am.
The devotee of the last